Welcome to AMAC's podcast, Better for America. Today's episode is brought to you by the AMAC app. The AMAC app is your go-to landing spot for up-to-date real news, polls, and interactive games. And in addition to all of the money-saving benefits that AMAC has to offer, now today's guest is Congressman Rich McCormick. He represents Georgia's 6th District, and we've got over 75,000 AMAC members in the Peach State, over 5,300 members in the 6th District alone, and we're thrilled to have him with us. Congressman McCormick is a Marine pilot, an ER doctor, and now a Republican warrior in Congress during one of the more tumultuous times in history. Congressman Rich McCormick, welcome to Better for America, and thank you for joining us.
Thanks. Good to be with you today.
Congressman, President Biden recently signed the Fiscal Responsibility Act into law. This is a move that averts a potential debt default and sets spending limits for 2 years. Now, we've seen both celebration and critique following this event. Even within the same parties, you've got Speaker Kevin McCarthy on one hand proclaiming the deal as a major victory, while on the other hand, there are conservatives who voted against it, arguing that it really doesn't go far enough in cutting spending. Could you share your perspective on this situation? Specifically, how does such a divide exist within the Republican Party regarding this act? And more broadly, how can these views influence the party's approach to fiscal responsibility in the future?
Sure. Let me talk about the realities of it. As most of you probably realize, I voted against it as one of 71 people who voted against it. The majority of the votes came from the Democrats. It was something that I think we as a party worked hard on. We had an act that we had already signed and we had already passed that basically I think had much better regulation, much better accountability for our budget process. The fact of the matter is that we have a very slim majority. We only have 5 votes, now 4 votes of a majority. That means you have limitations when you don't have the Senate, when you don't have the White House as to what you can actually get passed. I think Garrett Graves and Patrick McHenry worked very hard to see what they could get done. I think the Speaker worked very hard to see how they can negotiate with the President. They tout the fact that we've actually reduced the budget for the first time in a very, very long time. My problem is this. No matter what savings we do, it's only based on 11% of the budget. In other words, the non-military, non-VA discretionary spending, which starts off at 30% when you disclude the military and VA, you're talking about 11% of the budget is what we cut. So it's not really an honest discussion because, quite frankly, the rest of the time, everything else continues to grow. The president himself still continues to have executive order privileges that are out of check. So any meager savings we might have on 11% of the budget can be overridden by a executive order that could grant up to $1 trillion of, for example, student loan forgiveness. Until we rein that in, that was my red line in the sand is taking back control of the budget, which we have control constitutionally, but we continue to have to take precedents to all the way up to the Supreme Court to actually get the law upheld, which is the budget belongs to Congress. And we're not doing a good job of reining it in. We need to address non-discretionary / automatic payments or budgeting. And we're not doing a good job of that. Healthcare is out of control, consumes 1/5 of the budget and growing. 70% of the budget we don't touch ever. Now we're up to over almost 90% of the budget. So I think we have a lot to talk about. I understand the hard work that was put in here. I understand the limitations, but I just don't think it was enough.
And speaking of fiscal responsibility, I want to express our gratitude for your sponsorship of the Health Act. Now, the Health Act is a bill that enables primary care doctors to serve low-income patients and receive a tax deduction. So this would mean that more people would gain access to health care without increasing taxes. I think it's wonderful to see support coming from someone with a medical background like yours. Can you tell us why you supported this legislation and how it benefits both doctors and patients?
Sure. Well, first, let's point out the problem. Medicaid doesn't pay the bills. It is charity work for most doctors. It's the reason that some doctors don't accept Medicaid, at least not a certain payer mix, because you'll put yourself out of business. You can't support your employees. You can't support your bills if you're taking a hit every time you see a patient. This allows doctors to be empowered to see people who are basically impoverished, people who are on Medicaid for a reason, people who need help. And it allows us to charge the difference back to our basically as a tax credit, so that we're able to continue to see patients. And what we want to do is always serve the patients, do what's right. But if you're doing it at a larger payer mix than you can afford, you have to limit the number of Medicaid patients. This allows us the ability with um, those patients that are not able to pay their bills in the same way, for us to see them and get a tax credit to make things even, so we can actually continue our business and do the right thing for our patients.
Now, considering other pressing public health issues, one of them that really bothers me personally is what we're seeing: so many young people dying of drug overdoses. We see so much drug abuse, drug trafficking, drug overdoses. This is a major, major issue, I think, and should be one in the upcoming presidential election, because all of this is affecting the public health and safety of nearly every community in America. And it's a shame. Joe Biden does not seem to get it. As a former ER doctor, you've witnessed the impact firsthand. What steps do you believe should be taken at the federal level to combat this crisis effectively? And how can we ensure that those struggling with addiction receive the help that they need?
Yeah, something very near and dear to my heart. My last ER shift was December 28th. Every single night, the last 3 years, I've seen at least one overdose, sometimes as many as 5 overdoses. I've seen 4 patients of mine that I could not bring back. They were just too far gone, too much anoxia of the brain, too much tissue damage just from stopping breathing. It is a very real problem, and it's created at the southern border. There's a lot of nefarious people involved. You could say that China maybe is involved with their drug trafficking through the southern border. A lot of bad guys come across the southern border with no accountability. We lost 1.5 million people we know that crossed the border that we never caught. We're having a record number of terrorists caught at the southern border. We've encouraged people to break the law. We've discouraged people to follow the law. This is the Biden administration as a whole. But I'm going to tell you something, maybe thinking a little bit outside the box. You know, watching 110,000 Americans die of drug overdoses, it gave me a sobering thought. We could spend $1 trillion on building a wall. We could spend $1 trillion overseas fighting Colombians and Chinese and Mexicans and Central Americans that are coming here to do bad things. We could spend $1 trillion on drug treatment plans and everything else like that. But quite frankly, unless we give power back to the family, we'll never solve this problem. Too often at times, the Biden administration says they're God. They determine what's moral, what's not. That they're the solution to all your problems, whether it be in the family, in the community. Don't look to your church. Don't look to your God. Don't look to your family. Look to the government to solve your problems. Quite frankly, we've been able to solve the smoking problem in America with our youth by first, we said, look, smoking is going to give you cancer, but it's going to give you emphysema. But kids didn't care because they don't see health problems in themselves. They're too young. They're too healthy. They don't see that as reality. So then we started vilifying the manufacturers of cigarettes. We call them bad people. This is what they do. This is how they pollute people. This is how they kill people. And all of a sudden, they stopped buying cigarettes. There was a psychology behind it. But what we haven't done is done that with drugs. Quite frankly, we spend more time trying to tell them that they may be transgender than drugs are not only bad for you, but you're supporting murderers, rapists, people who would kill people coming across the border. They're not really fighting the right good fight. Kids are moral. They want to do what's right. They just don't see having a good time as immoral. But if you teach them that supporting drug dealers is literally supporting people who kill people and would child traffic and would rob you and encourage crime and horrible things, we'd get rid of this drug program problem in one generation. We got to stop turning back to the government to solve our problems. We got to turn back to the family, teach our kids what's important in education systems rather than trying to confuse them about their gender. Teach them how they can avoid a catastrophe in drug overdoses in America.
Yeah, that's so important. I mean, Congressman, I remember the nights when we heard the 10 o'clock commercial, "Do you know where your children are?" You know, we had a different society, it seems, that was more focused on the family and families looking after their children. And today we've got a government that's really got this Marxist approach that wants to weaken the family and take over and say they're all of our children. We've got a president who's acting like the moral police. And his decisions, in our view, in the view of over 2 million AMAC members, this is bad for America, bad for our future, and bad for this generation that's going to not only face incredible debt, but also a less safe America where They just want to do away with law and order, and are not promoting the right things. Certainly not in the schools, and certainly not on the federal level. It hasn't been addressed the way it needs to be. So we thank you for speaking up.
And I think it's important.
Please.
I'm sorry, one saved rounds on that. Everything we have is societal problems, whether it be crime, gun violence, drug overdoses, suicidality. All these things that we have is major problems in America. Once again, you can make all laws and rules. You cannot get rid of racism, for example, with a law. We keep on turning to the very institution that created the problem to begin with. And the more we do that, the more we're going to lose our way. I'm a conservative. I believe that we are the solution, that the Constitution was created to empower us over a government. We are unique in that way. That's what made America wildly successful. And the more we turn to the government to solve our problems, the worse our problems are going to get.
That's right. And it's exactly what they're doing with these illegal migrants coming to America. They're prioritizing them over American families, over Americans. And this is something I think that's going to play heavily in the presidential election, the upcoming presidential election. Another area that Joe Biden seems to completely ignore is that of the Social Security looming insolvency crisis. Social Security is on the minds of over 2 million AMAC members, especially with the increasing strain on the system. What kind of reforms do you believe we need to ensure for its long-term viability for future generations?
Well, let's think what got us into this to begin with. Quite frankly, I think it's a dishonest argument. You heard Biden talk about it in the State of the Union address, where he said Republicans want to cut Social Security. First of all, nobody's ever said that. We're having a dishonest argument because the law that was made that has an automatic cut when it becomes insolvent was made bipartisan. Matter of fact, I think the Democrats were actually in control when that law was made. So to pile it on Republicans as if we want to cut Social Security, we want to save Social Security, but we're going to have to make some hard decisions. If it's not going to be deficit spending, which a couple of these programs, for example, Medicare and Social Security, have a limit. If it's insolvent, it has an automatic cut. And so we have to figure out if we're either going to redraw the law so that we can have deficit spending on it, or it's supposed to be supplied in a very real way. This is money that we are taxed for individually, but now we're saying we're going to limit on people who make a certain income. If we want to do that, okay, fine. We better have that discussion. Quite frankly, when Social Security was initially instituted, it had an age limit based on the age expectancy of that time. Since that time, our age expectancy has gone dramatically up, but the law remains the same. So we have to have a hard conversation about that. This is where we say if you're going to kick it in earlier, maybe you take a smaller percentage, just like we do already, but you can even make it a larger age gap on that. I don't think we can continue with what we have right now. That's obvious. It will become insolvent, and then we have to decide we're going to continue with deficit spending, or we're going to actually have something to address this. There is no other way. I don't see any other way that somebody suggested, unless you have a solution. I'm open to any solution that you might have that's going to save this, but I think we're really going to have to address the age limit. Certainly, we have a lot of people that now they're trying to get on Social Security that never paid into the system. That's ridiculous. That's not what it's for. We certainly got to have protections for those people who are retired, especially when it comes to interest rates, when it comes to housing, when it comes to healthcare. But we have to have a realistic conversation about what that costs and how we institute it based on an age when people are working later and later in their life. And that's okay. There's nothing wrong with working. By the way, working actually extends your life. So don't think of working as a punishment. It's actually something that helps you live a healthy life.
Well, we appreciate your realistic approach. And yes, Congressman, we've been working over 10 years on a Social Security guarantee, and it addresses all of those issues. The best part of AMAC Social Security guarantee is it protects Social Security and keeps it solvent without increasing taxes. So we're excited to share that with more members of Congress. Now, given your position on the Select Subcommittee on the coronavirus pandemic, you have been involved in key discussions on information dissemination, particularly around the COVID-19 pandemic. And now we're seeing a similar issue emerge in a different context. Recently, YouTube announced a significant reversal in its election integrity policy. Listen to this. It will now allow content that claims fraud or errors occurred in the 2020 presidential election and other U.S. elections. They'll allow those comments to stay up. They framed this as an attempt to avoid curtailing political speech. So, drawing from your experience on the coronavirus subcommittee, where accurate information is critical, can you comment on this policy change with YouTube?
Well, let's start with the coronavirus thing. First of all, I'm the only person in Congress who actually treated patients for coronavirus. That's why I'm on the committee to begin with as a freshman, the only freshman. There is a lot of misinformation out there, yes. But here's the funny thing. If we have YouTube or Twitter or anybody else determining what that is, they get it wrong a lot of times. Quite frankly, I was censored a couple times, a few times, and I ended up being right, and the government ended up being wrong. So who's to say who's right and wrong? Time will tell. And I think people, the consumers, have the right to determine who's lying and who's fabricating, what's an opinion, what's not. Obviously, that's why we have science. This is where it's going to get really confusing, especially with AI now. You saw there's been legal cases where AI has made up studies. You can do the same thing with medical studies, by the way. We're going to have to be very careful about moving forward. What is the truth? And relying on the internet is not always the greatest thing in the world. But I think it's important to have this conversation as we move forward. How do we have a trustworthy source? Unfortunately, and this is the real unfortunate part, because we politicized a disease, now we have a mistrust of certain doctors, certainly the government, who got it wrong in many cases as far as the origins of this disease, how to treat it, not allowing our medical professionals to have a relationship with their patients without encumbering that relationship with their own idea of what facts were. But I think overall, it's good to have a discussion that's out in the open, which allows that dissenting opinion. Because at one time, doctors were in the belief that we shouldn't wash our hands in between patients. And when Dr. Lister stood up against them, he was ostracized as the outlying opinion, which turned out to be right. That's why it's okay to have a dissenting opinion, because sometimes the dissenting opinion ends up being absolutely correct. When it comes to voting integrity, there's still a debate going on that. When it comes to January 6th, there's a lot of dissenting opinions. I think the more we create transparency, the more we allow people to access the facts, even when it's uncomfortable facts, the better decisions we can make.
I want to tap into your unique set of experiences. Now, you've steered aircrafts through tough weather in Afghanistan. You've made split-second life-saving decisions in the ER. In your current role, you're in a different type of battle. You're grappling with crucial issues under President Biden's administration, from our economy to immigration to the healthcare system. As someone who has had to recognize and respond to crisis situations, how serious do you view these current challenges? And if we don't manage to get them under control, what do you think the repercussions might be for America's future?
So you're right. A lot of times I tell my staff, as a matter of fact, when things are going on, people are losing their minds, I look at my desk and I say, is anybody on that desk getting CPR? No, of course not. Is the floor moving in bad weather at nighttime while we're trying to land an aircraft carrier on it? Of course not. So let's not overreact. Quite frankly, we take ourselves a little too seriously sometimes in government, like we're the end all be all. That's part of the problem. We're not supposed to solve the world's problems. We're supposed to stay out of the way of people like you, the individual, which is the ultimate minority, by the way. The ultimate minority is the individual. That the Constitution was designed to protect the individual so that there wouldn't be a tyranny of the majority or a tyranny of the minority. We want to make sure that we're not ruled by a government, that they're not over-regulating us, over extending their power. You're seeing right now the government's being weaponized against its people. That is the most alarming thing right now to me, is how much power has been given to the government to quote unquote solve problems. When you continue to overspend by $1 trillion per year, when you use the ATF or the FTC or the IRS or the FBI or any three-letter organization in the government to threaten people who don't see the world the way they do, that worries me, because that's exactly what communist governments do. We need to make sure that we are in charge of the government. We, the people, not we, the politicians, not me, the congressman, but you, the people, are protected first and foremost. That's why we have a constitution which gives you your inalienable rights, which outlines those so that we don't have an overreaching government. If you want to talk about everything that I do, will be centered around that, making sure we are out of the way so that you can prosper. And that is what made our country more prosperous than any country in world history. It will continue as long as the government stays out of the way. The more powerful the government gets, the more overreaching it becomes, the scarier this is going to become. And then you'll see me react even more so But we got to tackle some real spending problems, some real government problems. As a matter of fact, half the time I spend in Congress right now is trying to fight against bureaucracies who have overstepped their bounds, that are making their own laws as if they're legislators. You're not a legislative body. You are a bureaucracy that's supposed to enforce laws, not create laws. We shouldn't have the ATF telling people that they can no longer own a pistol brace that they bought legally. That's not your responsibility. That's overreach. We should not have the FBI playing favorites in politics. We should not have policy or bureaucracies hiding things from your representatives. I think transparency is absolutely essential, unless, of course, it's a military special operations or something like that. We just have to know what's going on. We got to control it, and that comes back to empowering the people, staying out of their business, staying out of their, not telling them when they have to be vaccinated, when they need to close their doors, but actually allowing them to have access to unfettered, truthful facts so that they can actually make good decisions on their own. Because quite frankly, we are founded on a nation that put the kids in the back of a wagon, went west, may have froze to death, may have starved to death, may have been attacked by bad people, but they were allowed to take those chances because we're America, and that's the opportunity that they took in order to forge their own way.
Well, we're so grateful for your voice in Washington and helping to get government out of our personal lives. Thank you so much. We appreciate you, Congressman. We thank you for lending us some of your time today. And thank you for sponsoring for the Health Act. This is an AMAC, AMAC's founder, Dan Weber, who thought it would be just a great idea, and Congressman Webster agreed. We are thrilled that you've sponsored the Health Act. Keep up all of the great work that you're doing. You're courageous, you're brave, and you're better for America. God bless you, Congressman.
And God bless you, and God bless this great country of ours. Semper Fi.
If you enjoyed this episode, you can listen to more just like it. Check us out on iTunes, Spotify, or by downloading the AMAC app. Don't forget to follow us on social media. Until next time, I'm Rebecca Weber. This is your podcast, Better for America. Thank you for being here. Have a wonderful evening.